On April 2, 2026, the Centers for Medicare and Medicaid Services did something highly unusual. They dropped 3 separate major proposed payment rules for post-acute care on the exact same day. Skilled nursing facilities, inpatient rehab facilities, and hospice providers all received their new guidelines at once. And across the board, the headline figure looks exactly the same, a 2.4% payment increase. But this chart shows what's actually buried inside the numbers. Over the last 7 years of data, CMS noticed a pattern they're calling case mix creep. The top line is patient severity coding, climbing rapidly. The bottom line tracks median per diem costs, which remain flat. Facilities are logging massive coding surges for conditions like malnutrition, depression, and swallowing disorders, without corresponding changes in actual patient health status. To hold on to that 2.4% funding increase, providers have a narrow window to overhaul their internal documentation systems. They have to prove their case mix index reflects legitimate clinical needs rather than coding tricks, or risk getting caught in CMS's new algorithmic dragnet. For most skilled nursing facilities, the standard billing workflow focuses rigorous, exact documentation almost exclusively on Medicare Part A patients. The FY 2027 rule mandates all-payer MDS expansion, requiring accurate paperwork for every single resident, whether Medicare, Medicaid, or private pay. While required paperwork multiplies, the submission window shrinks from 4.5 months to the 15th day of the second month. Trying to scale a manual MDS completion process to cover every bed in the building on a tightened deadline guarantees submission failures. Paperwork errors directly threaten a facility's revenue stream. Inpatient rehab facilities face a different operational reality. Flexible intake routines are gone. Now 3 strictly enforced timers start the exact moment a patient arrives. First, clinical staff must physically initiate all required therapies within 36 hours of midnight on the day the patient is admitted. Second, staff can no longer copy over functional status from a transfer note. They must independently evaluate and formally document the patient's current functional status right at admission. Third, the initial interdisciplinary team meeting has to happen on or before the 4th day of the patient's stay. Missing even a single marker shifts an admission from compliant to non-compliant. Precision, hour-by-hour time management is the new baseline for keeping an IRF operational. For hospice providers, election statement addendums, previously provided only when a patient asked for one, are becoming mandatory. Admission staff have exactly 5 days from the moment of election to deliver this paperwork to every patient. The larger shift in hospice oversight is a new surveillance tool, the Service and Spending Variation Index, or SSVI. The SSVI algorithm takes 9 claims-based metrics, like live discharge rates, nursing minutes, and non-hospice spending, distilling them into a single numeric risk score. That score is posted directly to CMS's Care Compare website, next to competing agencies, visible to every referral source and family. Internal operational statistics used to sit quietly in management meetings. By October, those same numbers act as a highly visible public grade that dictates who gets referrals and who gets shut out. CMS locks down the final language for all 3 of these rules in August 2026, with strict enforcement starting on October 1st. Relying on physical clock watching, manual data entry, and static spreadsheets cannot handle the sheer volume and speed of this new oversight. Facilities must upgrade their infrastructure immediately. That means integrating AI-assisted auditing for MDS coding, automated submission tracking to hit tighter deadlines, and real-time monitoring to spot dangerous SSVI score trajectories before CMS publishes them. The FY 2027 rules deliver a 2.4% pay increase, but CMS is using that money to force a structural modernization across post-acute care. The providers who survive the transition will be the ones who automate their daily compliance right now.